Hello, everybody. This is Dr. Grant Ely. Glad to have you today. We're going to go over medication mastery. And our goal today is to look at blood pressure medications. So as you can see, our tool here, Medication Mastery, brought up a class of medications. You have diuretics, ACE inhibitors, and so on. What common medications are included in those, the description of what they do, and where they're used, such as hypertension, obviously, and angina and heart rhythm disorders. So it's asking us if we'd like to focus on a specific medication or like to proceed with an overview of one of them. Let's look at ACE inhibitors, which is one of our class of medications there. Great. So it covers the mechanism of action, which is responsible for converting angiotensin 1 to angiotensin 2, a potent vasoconstrictor. And then by inhibiting this conversion, ACE inhibitors leads to vasodilation, decreased blood pressure, and reduced workload on the heart. So it's making those vessels larger, thus decreasing the pressure that's in them and making the heart work a lot less because it's not pushing against really enclosed small vessels. It talks about some of the, we'll learn there's some pharmacokinetics and therapeutic usage. Blood pressure, heart failure makes sense. If you're having a hard time with your heart, you don't want it to work as hard. So this becomes a good one. Lisinopril is one of the main ones. So you'll want to be monitoring, obviously, for blood pressure, renal function, check for signs of angioedema. It talks about different precautions. One in particular is severe renal impairment. Some normal things you might see is cough, elevated potassium levels, hypotension, angioedema, and caution in some of these. And here's some of the drug interactions. Interesting. NSAIDs may reduce the antihypertensive effect. Fascinating. All right. So let's says, would you like to proceed to the first learning pathway step? Yes, please. And what Medication Mastery does is it goes through several steps. This first one is nursing considerations and critical thinking. So during the patient assessment, we'll get a complete history, vital signs, labs, particularly that creatinine and potassium. And so some of these we went through in the last section. So this gives kind of an overview of our ACE inhibitors. And now would we like to proceed to the interactive quizzes? Yes, please. All right, so let's test your knowledge on ACE inhibitors and their administration with some questions. Here's the first question. Which of the following medications is an ACE inhibitor? And if we remember, lisinopril was one of them. Correct. Awesome. And it does give rationale for the other ones. What is a common adverse effect of ACE inhibitors that patients should be informed about? Okay, so one common adverse effect, we talked about how a cough is one that we need to be aware of. So we'll go ahead and mark B. And what's nice is Medication Mastery, these tools will bring up different questions, usually every single time, to help us to learn and reinforce our focus topic. What lab values should be monitored regularly in patients taking ACE inhibitors? Okay, so probably out of these, we have to be aware of where the potassium's at. All right, 3 for 3. Question 4, which of the following is a contraindication for prescribing ACE inhibitors? So we give it for heart failure. Probably angioedema we had to worry about. We give it for hypertension. B, so probably B. Again, I've never seen these questions before. Oh, good. All right, we got that one correct as well. So our final question, when is the best time to administer an ACE inhibitor to a patient who experiences hypotension, so that low blood pressure? Immediately after meals, at bedtime, in the morning on empty stomach, only when blood pressure is elevated. Boy, I don't know on this one. So let's say at bedtime maybe. All right, we were correct. Well, let's find out why that was. So administering an ACE inhibitor at bedtime can be advantageous for some patients, particularly if they experience hypotension or low blood pressure, as it can help avoid occurrence of hypotensive symptoms during the day when activity levels are higher. So probably dizziness is the main one, or when you get up really fast, that orthostatic hypotension that some may experience. And then it gives some reasons maybe the others aren't the best time to give lisinopril or ACE inhibitors. Okay, would you like to proceed to the next step? First realistic patient, yes. So now it gives two realistic patient scenarios. The first one is easier than the second one. Doesn't mean they're both easy or difficult. It just means that the next one after this should be a little bit more difficult than this one. So John Smith, age 62, hypertension for 10 years, type 2 diabetes, mild heart failure. John presents with blood pressure of 150 or over 90. He reports feeling lightheaded occasionally when standing up quickly. That's that orthostatic hypotension we talked about. His last labs showed a serum creatinine of 1.2 and a serum potassium of 4.5. Okay, so the scenario is John is in your clinic today for a follow-up visit. He mentions he has been compliant with his medications, but he has noticed that he feels more lightheaded recently. He also reports that he has been following a low-sodium diet as advised. As a nurse, please explain what steps you'd take in managing John's regimen and addressing his symptoms. Consider all these things that we normally would as a nurse. Take your time. Okay, so in this case, I'm just going to write, I don't know, and allow ReadyRNs to teach us what to do. And that's one nice thing is this. It's like talking to a friend. You just write whatever you need to write. Sometimes you know things, sometimes you don't. And that's okay. And in fact, ReadyRN says that's completely okay. Let's break it down for step by step. So first, we would assess John's vital signs, make sure his blood pressure and heart rate are okay, and looking at that orthostatic hypotension, asking John about his lightheadedness. It's great idea. Lab review, we want to see how his kidneys are doing and his electrolytes for the potassium. All right. Compliance, diet review. Wonderful. Looking at his medication review, renal function. Okay, so let's start with medication review. Assess if the current dose of lisinopril is appropriate considering his blood pressure and symptoms. If he's experienced significant lightheadedness, the dose may need to be evaluated. Consider speaking with a health provider about possible adjusting the dosage of lisinopril or investigating the need for additional antihypertensives. As far as renal function, given John's diabetes and existing renal function, continuous monitoring should be emphasized, and plans for routine follow-up should include assessing renal function if dosage changes are made. If symptoms persist or if there are indications of renal complications, refer John back to his primary care physician for further evaluation and schedule a follow-up. As a nurse, it's important not only to respond to the patient's medication concerns, but also proactively educate and assess effectively. Always be observant of how medications might interact with patients' overall health status, and don't hesitate to communicate with the medical team for any adjustments. And we're pretty good at that as nurses, working with our team. So let's do our last patient scenario. And again, this one most likely will be more difficult. But as you can tell, if they're difficult or not, it's easy to say, I don't know, and then ReadyRNs will guide you through. So this is Mary Johnson, age 78, has had hypertension for a while, does have kidney disease, chronic kidney disease, heart failure. Mary presents to the emergency department with complaints of shortness of breath and swelling in her legs. She has feeling more fatigued over the past week and states she has not been able to keep up with her daily activities. Blood pressure is noted at 160 over 95 and her heart rate is 88. And she is on these medications. Serum creatinine is 2.0, serum potassium definitely high, and your BNP is 450. As a nurse, please explain how you would approach the management of Mary's conditions, focusing on steps you would take to assess her situation. All right, so I'm going to write I don't know again, and let's see what ReadyRN says to do. I like the positivity. It's perfectly fine. So we're going to look at it step by step. So assessing her vital signs, we're paying careful attention to her blood pressure and heart rate, noting any deviations from normal parameters. We're looking at her respiratory status, especially with heart failure, where that fluid can build up in the lungs. So we're looking for crackles or wheezing, inspecting the legs for edema, and evaluating her level of consciousness and fatigue to understand how heart failure may be affecting her daily activities. Serum creatinine of 2.0 suggests worsening renal function, which needs attention due to her chronic kidney disease. Serum potassium of 5.8 indicates hyperkalemia, which can be exacerbated by her current medications, especially enalapril. Her BNP of 450 suggests heart failure exacerbation. So what to do? We're going to educate the patient. Let's share the results with Mary. We're going to discuss treatment options, especially due to her elevated potassium levels and renal function status, and any adjustments to medications as needed. So what are the potential interventions? So we're going to look at the medications. With the serum potassium being elevated, it may be necessary to hold the enalapril and discuss with the provider about switching to an alternative class or adjusting dosages. Furosemide, given that she's experienced fluid overload, shortness of breath, and swollen legs, consider administering a dose of furosemide if it hasn't been given recently, and monitor her urine output closely. Amlodipine, assess whether this medication is beneficial compared to the other medications, considering her heart failure symptoms. So we're going to implement close monitoring of her cardiac function, how the diuresis with furosemide and electrolyte levels, particularly potassium, since furosemide does affect potassium. Talk to the medical team about adjusting medications, especially in light of her renal impairment and hyperkalemia. Okay, constructive feedback. And I think we went through most of these. Perfect. Okay, would you like to discuss any part of this scenario or have any questions about medication management, or do more quizzes and more patient scenarios? So in this case, let's ask, why do we need to be concerned about renal function with enalapril? So you can talk, again, you can ask questions anytime. Let's see what it says. So ACE inhibitors, including enalapril, work by inhibiting conversion of angiotensin 1 to angiotensin 2. Angiotensin 2 is responsible for constricting the efferent arterioles of the nephron, the functional unit of the kidney, which helps maintain GFR under conditions of hypotension or renal artery stenosis. Okay, so I'm going to say, can you explain it more simply so I can understand? Okay, perfect. Okay, so kind of similar information, but it's fine just to ask it to kind of simplify things for us so we understand. So it says it works by blocking a substance in the body that narrows blood vessels called angiotensin 2. When this substance is blocked, blood vessels relax and blood pressure goes down. The kidneys get their blood supply from the arteries and they filter waste from the blood. Normally, angiotensin 2 helps keep the blood flow to the kidneys steady, especially when blood pressure is low. When you take enalapril, it lowers the level of angiotensin 2, which can reduce blood flow to the kidneys and possibly less kidney function. If a person already has some kidney problems, taking enalapril can make those problems worse. This might cause the kidneys to fail more quickly or even lead to sudden kidney injury. This is often called acute kidney injury. Enalapril can also cause the body to hold on to more potassium, which is something that usually gets pushed out through the urine. If your kidneys aren't working well, too much potassium can build up in your body, which can be dangerous and lead to serious heart issues. Wonderful. All right. Well, again, you can ask questions like that any point during the process as you learn these medications. You can ask it to simplify it. We could even ask it, hey, can you liken it to tennis or something else that you enjoy doing, or hiking? And it will take these principles and help you to understand the medications from a point of view that you get. Well, I hope you enjoyed going over medication mastery today, and happy practicing. Thanks.